Hello, this is Aishwarya Kapoor and you're watching COVID-19 Bulletin. The latest sero survey conducted by the Indian Council of Medical Research has found that 2 of the 3 Indians have COVID-19 antibodies. The survey shows that India is gradually moving towards herd immunity. However, caution still needs to be exercised. This latest survey was conducted in the month of June to July across 70 districts of 21 states in India. Similar surveys were conducted in the country in the months of May to June and August to September last year and December to January 2020-2021. This fourth sero survey in line was done on 28,975 people, and unlike the earlier ones, including children in the age of 6 to 17 years, making it more inclusive in its results and predictions. As there are many asymptomatic or mild cases of infection, one cannot know the actual number of people who have been infected in the past by the mere reported RT-PCR positive results. In a sero survey, the blood of participating individuals is taken and is tested for the presence of COVID-19 antibodies, which confirms if they have had any previous exposure to infection. The results of this sero survey caution that 1/3 of Indians, which are around 40 crores in number, still do not have antibodies against COVID-19 and hence are vulnerable to infection. This once again emphasizes the necessity to follow COVID-19 appropriate behavior. So, mask up, Indians. Moving on to the next story. Bengaluru-based Indian Institute of Sciences has now registered success in developing a warm COVID-19 vaccine that can stay stable at 37 degrees Celsius for a month and can even tolerate temperatures up to 100 degrees Celsius after a freeze-thaw cycle. This warm vaccine is a ray of hope for India and other tropical countries like India that are struggling to provide cold storage and transport chain facilities to provide vaccines in remote and far-flung areas. This newly developed COVID-19 vaccine is based on a part of the spike protein of the novel coronavirus called the receptor binding domain, the region that helps the virus stick and enter the host cell. Scientists have tested this vaccine in guinea pig models and found that it triggered a strong immune response. The scientists have published the results of this vaccine in the Journal of Biological Chemistry. As per the scientists, this protein-based vaccine like this can also be scaled up easily in India as manufacturers have been making similar vaccines for decades. Most of the currently used COVID-19 vaccines need refrigeration at least 2 to 8 degrees Celsius and also require cold transport chains to carry these vaccines to remote locations. Also, at the point of delivery, there is a requirement of cold freezers to store vaccines and expensive cooling equipment to keep vaccines cool while administering them. This newly developed vaccine, which can stay at room temperature without getting degraded, will therefore reduce the burden on health facilities for delivering vaccines. Kids can better handle COVID-19 infections, said Professor Balram Bhargav, Director General, Indian Council of Medical Research, in a recent press conference. This statement comes as a major relief to parents who fear the safety of their unvaccinated children from COVID-19. Giving the reason for less severe symptoms of COVID-19 in kids, Professor Bhargav said that children have less number of ACE2 receptors in their lungs than adults. As ACE2 receptors are the entry points of virus in the cells, therefore, less number of these receptors in children's lungs hampers the replication of virus, leading to only mild or moderate infection in kids. Professor Bhargav also pointed out that sero survey results show that 57.2% of children aged 6 to 9 years had COVID-19 antibodies, confirming their previous exposure to corona infection. Citing these reasons, Professor Bhargav suggested that primary schools can be opened up in India as well, given that teachers and other school staff are fully vaccinated. It's been a long time since kids have not been to school, which is not only affecting their education but also overall development. Well, that is all for now in this bulletin. You can share your feedback and suggestions to us on the email ID flashing on your screens. And for more such videos, download India Science app or visit our website www.indiascience.in. And don't forget to follow us on social media as well. We'll be back with another edition of COVID-19 Bulletin soon. Till then, take care and stay safe.